Today we're talking about women's health, access to abortion services, reproductive rights, and the genesis of this day was probably planted by House Speaker Tom Tillis, of all people, in 2013 when the General Assembly at the last minute had a motorcycle safety bill, and Sarah Preston knows this better than anybody, has a motorcycle safety bill in a committee, and all of a sudden a motorcycle safety bill was turned into a bill to restrict access to abortion services for women, which led to, I think, the weirdest quote of the whole General Assembly session during the debate on the House floor. Somebody was complaining about the process and talking about it, and the Speaker of the House said, "Please stick to the contents of the bill." And I thought, what? Motorcycles and abortion services. So that's how far we've come. But we're thrilled to have Judy Waxman here today to talk about it and tell us what's happening and on the national level and what's at stake. And Rob will be introducing her.
Thank you, Chris. I do want to introduce Judy Waxman. I also want to thank our co-sponsors for today's events, North Carolina Now. Galia Paliga, the president of North Carolina Now, is here with us this morning. North Carolina Women United and Women Advance all helped promote this event. I want to thank them very much. Maybe we'll let Galia have first question or first crack at Judy after she offers her comments. Judy Waxman, our speaker, is with the National Women's Law Center, which has been around since 1972. And they are a staff of around 60 folks these days, sort of on the forefront of any number of important issues that defend the rights of women in our country these days. Judy is the Vice President for Health and Reproductive Rights, and she pioneers advocacy, policy, and educational strategies to promote the quality and availability of health care, including reproductive choice for American women. And prior to joining the Women's Law Center, Judy served as Deputy Executive Director of Families USA, a group with which all of us are familiar, most of us anyway. She was there for over a decade. And in that capacity, she worked to achieve high quality, affordable health and long-term care for all Americans, and was a leader on grassroots and activities on Medicaid, Medicare, and other healthcare access legislative issues. So obviously she's extremely conversant in two of the most important issues that have sort of converged in the American public policy debate these days, reproductive rights and access to health care. She previously served as a professional staff member with the Pepper Commission, that is the United States Bipartisan Commission on Comprehensive Health Care. She's also been an adjunct professor at Georgetown University, been an attorney for the Department of Health and Human Services, president of the board of directors of the Women's Medical Center. She served as an advisory committee on advisory committees for publications at the Alan Guttmacher Institute and the Older Women's League. Chair of the Health Task Force of the Leadership Conference on Civil Rights and the Leadership Conference on Aging Organizations. She holds a law degree from American University and a bachelor's degree from the University of Miami in Florida. So in short, again, you can see she's truly a national expert on some very critical issues in these times. So I'm delighted to have her with us this morning. She was actually speaking at Duke Law School, is speaking at Duke Law School at noon today. Adam Linker from our Health Access Project made the excellent suggestion that we try to corral her to get up at the crack of dawn and slip over this morning. She's been staying with her daughter in Durham and in town, so we're delighted to have her. Please join me in welcome.
Well, good morning. I didn't mind getting up at the crack of dawn. I'm used to that. But so happy all of you were as well. The National Women's Law Center, I'm going to stop in a second and say I have a few remarks. I want to keep it somewhat short, and I hope we'll have time for a good conversation. The National Women's Law Center works on a variety of issues. Our different departments are on education and employment, family economic security, and I head up the Health and Reproductive Rights. Our overall motto is expanding the possibilities for women. I personally have been involved in healthcare reform, as Rob said, and issues on access to health insurance for low-income people, really my whole career. And as the Affordable Care Act seemed to be gaining some steam in Congress, we thought about what it was that we could do to highlight some of the problems women have in particular, and we wrote a report called Nowhere to Turn. What we found, which we really already knew, but we were able to document how women in the individual insurance market get charged more than men for the same health plan. I mean, we looked state by state, and it was really consistent across the country. And I will say those plans that we looked at did not cover maternity care. That wasn't the difference. That's where everybody goes. In fact, 92% of health plans in the individual market did not cover maternity care, so it wasn't that hard to find those plans. And we came up with a campaign called "Being a Woman is Not a Pre-Existing Condition." Maybe some of you heard of that. It really, it really took off in a way we really didn't expect. But it kind of captured what it was that we were trying to say. You have to change how the insurance market works to make sure that everybody can get affordable health care. And in fact, what happened was, which we were super proud of, when Nancy Pelosi brought the bill to the House floor, you may recall it was the Senate bill that she just had to bring over to the House and get passed as is. She ended her talk with saying, "And a woman will no longer be a pre-existing condition if this bill passes." So we got a lot of pleasure. I personally got a lot of pleasure from hearing her say that. And of course, in my mind, it should be called Pelosi care anyway, not Obamacare. But at any rate, a lot of what we did leading up to the passage was to try to improve the bill, of course, for women. And one thing we focused on a lot was preventive health services. Senator Mikulski added a section to a whole long list of preventive services that were going to have to be covered in every health plan. She added a section saying, and preventive services for women have to be included. We were able to take that later on, and that leads to sort of where we are today with a whole bunch of women's services being included. But before I get there, I just did want to say that where you are here in North Carolina is because of the Supreme Court decision, of course, that said that Medicaid was something, this new program was a whole different program, and that states didn't have to actually take it up if they didn't want to. And sort of as an anecdote, I went to the Supreme Court argument that on that case there were like 3 different arguments. The place was packed and you couldn't get in, except for the Medicaid argument, there was room to go in, and that's the one, of course, I wanted to hear. And it was like, it was very surreal. Like, what are they talking about? It's a different program, and what is that? I mean, it was just really very bizarre. And of course, at the end of the day, it was great that the basic law was upheld, but really devastating that Medicaid then became an option, that expansion became an option for the states, even though, of course, the state right now would get 100% match, 100% of the costs, and it does go down to 90, but nevertheless, states have that choice. And I'm very hopeful that over time, the farther away we get from the political tension of passing the law, that we will in fact have more and more states, including North Carolina, take that up. We are issuing a report, an update of a report that we did last year, which was called Mind the Gap, looking at this Medicaid gap. And our new report is still minding the gap. And we do look at the states that have not yet taken the money for the expansion to show how, it's going to be shocking, low-income women with insurance do way better in accessing health care than low-income women without health insurance. But we have a number of measures, and hope you'll be able to use that report next week to your advantage. So let's go back to the preventive health services. So the preventive health services, as I said, it was just a general topic. Ultimately, Department of Health and Human Services set up a task force to figure out what should be in there. And they came up with 8 services for women, and among them was the HPV vaccine, gestational diabetes, breastfeeding supplies, and counseling, a well woman visit to get all the screenings you need, and of course contraception. And that became a lightning rod. The agencies put out regulations and guidance that said what this means is that every woman would in their health plan, now this is private plans in the exchange, not in the exchange, big plans, all plans will eventually have to cover all contraceptives without a copay, and that is the full range of contraceptives that are available, no copay, and a few other rules we can talk about too. It does apply to the Medicaid expansion, this requirement. It does not apply to the traditional Medicaid program as it exists. States have always had the ability to just define what contraception means on a state level. And I will say that for me, I felt like I wish I could call Margaret Sanger and tell her about this. I mean, you know, what that woman went through. There's a new book out, I understand. You may have seen reviews, and I really, When the Pill Was Born, I think it's called something. I feel like I need to get it. But, you know, what she went through just to tell women about it. And here it's going to be eventually in every health plan, any kind you need without cost sharing. So it is like a dramatic step forward for women and their families. I don't want to leave out the men, you know, it's a dramatic step forward for them too. So the administration, after this was decided, not everybody was happy about this, of course, and there were sort of press and noise, and so the administration put out a rule that said, okay, we're going to single out birth control, and houses of worship, churches, etc., don't have to cover birth control if they don't want to. They also said, if you are a nonprofit organization that holds yourself out as a religious organization and don't believe in birth control, we're going to set up this special accommodation. So first of all, who are these groups? They're groups like Catholic hospitals, Georgetown University, lots of universities, Catholic charities, had to be a nonprofit and affiliated. And this accommodation, which you'll hear more about, goes like this. You, entity, do not have to cover contraceptives, some or all, and some of them are picking some they don't like and others they do like. You don't have to actually cover this service. What you do is sign this piece of paper. It says, I don't want to cover XYZ. Send it to your insurance company. They're going to have to cover it or figure out how to cover it. So the actual employee or woman on the plan gets the coverage like everybody else. And that went into effect August 2012. Of course, the lawsuits began. So the for-profit companies are going, wait a minute, what about us? It's like, what do you mean, what about you? Since when does a corporation have a religion? Never heard of that before. Of course, the Supreme Court never heard of it either until this case. And they said, so there were like 70 lawsuits. And the courts were going both ways.
Sorry, I don't know whether that's...
Is it not on?
Yeah, it's been flickering on us a little bit.
Oh, sorry.
No,
I'll try to
you.
speak directly.
No.
So the courts, basically, the federal courts at the district court level and appeals court level were going both ways on this. It was like, what? Now, I do want to say this is not a constitutional issue. It really, it was an issue under what is called the Religious Freedom Restoration Act. I don't want to go too far into it, but basically, under this act, there's a whole test. Is this requirement, whatever it is, a burden on a religion? And if so, is there a compelling interest that the government made this requirement? And lastly, is there some other way that they could do it that would be less restrictive than the way they've come up with? And so basically, that's really the test for it. And the outcry was, you know, this is suppressing our religion. We can't leave our religion at the door of our business. Religious freedom, blah, blah, blah. And we're like, really? You're saying a boss can trump their employees' religion and impose their religion on their employees? And in fact, that is just about what happened. So we get to the actual Supreme Court decision last June, and it was 5-4, which tells you something about the split and the polarization. And basically, the court said, yes, this entity, this for-profit corporation, first time ever, can avail itself of this Religious Freedom Restoration Act. Didn't really say it's a First Amendment, you know, they can do it under First Amendment, but like who knows what's coming next. But yes, you are religious because you are a family-owned, quote, closely held organization, and all the owners have this religious belief. And therefore, you are the corporation, and therefore the corporation, in effect, has a religion. And so they said, yes, we see how this is a burden on your religion, and we had written a brief on behalf of 70 organizations, women's groups and reproductive health groups, and we talked a lot about the compelling interest, of course, of this particular requirement, how it helps women's health and their families' health, how it is, it was the CDC's one of the top 10 public health achievements of the 20th century, what it does for women's well-being and income and equality. And the court really didn't analyze that very much, just said, okay, we're going to assume it's a compelling interest, but we also assume that this is a burden. We're just going to take it at face value. If they say it's a burden, this is Alito speaking, if they say it's a burden on their religion, we're just going to assume it is, and not really think about whether or not. Of course, Ginsburg had something to say about all this. But the interesting thing is they did say, well, it's because there's this accommodation that I mentioned before for the nonprofits, a lot of language about, well, there is this other way to do it, this accommodation. So we're going to say, they come very close to saying, just do it this other way. They don't quite say that, but they say, well, this other way exists, so therefore we're going to say the corporation wins. And Ginsburg, of course, said, you know, you guys are walking into a minefield here. You don't even know what you are opening up. I mean, she literally used those words in the dissent. As I said, it was 5-4. Because they said this is only about birth control. But really, how can the rationale only be about birth control? And interestingly, a case came up recently in Utah where a member of the, oh shoot, I'm forgetting it. It's the Mormon sect that is the sect that still believes in polygamy. I forget what they're called.
FLDS.
Yeah, something, yeah. So this guy, there was an investigation going on because the head of it would close school so all the children could go into the fields and pick pecans. So there was a federal investigation going on, and he said, well, under Hobby Lobby, it is against my religion to testify, because one of the tenets of my religion is that we keep our internal issues internal. And the judge upheld that.
Wow.
So, I mean, it's really hard to know what's coming, but it's pretty darn scary. So, okay, back to Hobby Lobby itself. The administration has recently put out a call for comments. In fact, they're due today on a new rule that would apply the accommodation to for-profit organizations. But one of the major questions is, what is a closely held corporation? Because we did a lot of legal research. There's just a million different definitions. We, of course, in our comments, again, we work with our whole community of groups. We are trying to define it quite narrowly. Well, it has to be the same interests of a limited number of owners that have this religion, and they unanimously agree, and so on and so forth. So we'll see what happens with that, but how far this accommodation is going to be opened up is really still up in the air. So in the meantime, some nonprofit groups, not all, but like Notre Dame is one of them, for example, and there's a whole bunch, about 50, who are saying, wait a minute, we don't want to sign that piece of paper. Because if we sign the paper that says we don't want to cover this contraception and send it to our insurance company, then they're going to provide the contraception. And we don't want the women to have the contraception. Wow. So that is against our religious beliefs to sign the piece of paper. Wow. So this is now working its way through the courts. On this issue, I have to say, so far the courts have been with us the whole way. But, you know, who can predict these things? So we have written a brief, and here we are, whereas this accommodation we were never in love with in the first place, and now we're writing briefs saying, but you said the reason you ruled for Hobby Lobby was that there was this accommodation available, and so you, justices, have to uphold this dumbo accommodation, if I could. And suddenly we're these big proponents, because this is what we have left. We're just trying to make lemonade out of lemons. And this is moving through the courts. It's at a number of appeals levels. I mean, who knows, if the courts all go in the same direction, maybe the Supreme Court will do what they did with the gay marriage cases and just say, well, we don't have to decide this because everybody is in the same place, and that would be a good thing. But that is what is happening over the next year. So we also believe, of course, that whatever the definition of closely held is and how they tell these corporations they have to comply, there'll probably be a whole other rash of lawsuits by groups who say, well, we don't like this definition, we think it's too narrow, whatever, whatever. So this is not ending soon. And it's just amazing that this is about birth control. I want to get back to the beginning. I mean, 99% of women in this country use birth control at some time in their lives. It is totally accepted by the public, by women of every religious group, and yet this is what we're battling about. So we have hope that it is going to work itself out, and at some point some people will come to their senses. Congress can fix this, and I want to say, I don't know about your state, but states can fix this. They can pass a law fixing it. Okay, that's what I kind of. So anyway, it is our job, we think, at the National Women's Law Center, to make sure that this part of the Affordable Care Act is implemented, but really that the whole law is implemented and improved over time, so that all of us in this country, you know, will have access to quality, affordable health care. Thank you.
So obviously, Judy's left us some time for questions and discussion. I don't know if who wants to lead it off. There are David, you want to start us off?
Great presentation. Thoroughly learned a lot.
Right.
But tell me, this move among Republicans now, I even said the word, to push the over-the-counter deal.
Mm-hmm. Right.
Talk about that.
So it's very tricky on their part, because what they're basically saying is, well, birth control doesn't have to be covered by your health insurance, because you can just buy it at the pharmacy. And if it's put on the shelves over the counter, you don't even need a prescription. And interestingly, there is a movement by some people who would like to see more birth control over the counter. But of course, I mean, some people on our side who say, you know, a lot of it is so safe, why do you need to go to the doctor and get a prescription? But it's the insurance coverage that's here at stake. Exactly. And of course, it's not really that cheap, you know, and we have done some graphics in our social media, and actually Ginsburg said in her dissent that for a woman with a minimum wage salary to get an IUD, it would take a month's salary. Mm-hmm. And I think that captures it, really. So sure, saying I'm for women getting birth control, I just don't think it should be in your insurance policy is really what they're saying. So that if your boss doesn't want you to have it, they don't have to pay for it. But over the counter only solves part of the problem. You can get it, but if you can't afford it, then you can't get it. And that's really what it's about.
So what is your organization and other organizations doing to try to counter that? Because that's becoming quite a mantra among the Republicans.
Yeah, well, it's kind of hard because we're just trying to explain it. And obviously I didn't explain it that succinctly. But over-the-counter means no insurance coverage. Probably we should do more about that. It means you pay it yourself. Maybe that's a better way that would get people's attention. We probably should do more. Interestingly, and I see, you know, I live in DC, but I get all the ads from the surrounding suburbs on the TV, and there's some Republican running in Virginia who keeps saying, I'm for over-the-counter birth control with insurance. Like, I don't even know if he knows what he's saying exactly. I kind of get what he's saying because I know who he is, but he got mixed up somewhere. I've heard that ad like 1,000 times. So, but you're right, we should do more on that.
My name is Vita, and thank you, and again, great. And I just want to talk about the economic impact of that, because I also think so much with the Affordable Care Act, we're put on the defense about it, and there are actually a lot of good things. And maybe I'll meet a man today who has paid for his woman's birth control, but I haven't met one yet. So there's a real economic impact that's happening there. I mean, I think absolutely on all the health care and all of that, but I myself would be dead today were it not for birth control 20 years ago, of which I had to have my doctors waste their time fighting an insurance company to actually get that approved, as opposed to providing, you know, quality care to another patient. So, you know, just purely from the economic impact, where men and women benefit from birth control,
Right.
and yet women bear the economic burden of paying for that.
And you don't hear the men part very often in the discussion, I know. I mean, we are trying to bring that out. In fact, I have, I don't have it with me. I should probably get your list or something. Yeah. We've been doing a lot of social media, and we have some of these graphics where we actually have a calendar showing, like, if you are a low wage, I think it's minimum wage worker, and there's 3 calendars, how many days it would take to pay for the pill, how many days it would take to pay for the ring, another kind of in-between cost method, and the IUD, which is a whole month. And I mean, you're just totally right. It's about money out of your pocket, but it's also about women's economic well-being. Yes. Because there's tons of studies now that show what birth control has meant for women's economic well-being. And I mean, it's kind of like duh, but somehow we have to keep saying this.
Yeah. Questions are coming fast and furious. Right here in front, and then Vicky.
So I've got a couple questions. My name is Septina. What do you think the research impact of this would be? Meaning, how is it going to affect research in the future for health, for women's health, reproductive rights? And then my second question is, globally, how do you think this is all going to tie in to if this is the benchmark for how the U.S. responds to women's rights? How do you think this is going to tie in globally?
You know, those are great questions, which I don't have clear answers, definitive answers to, but I will say, you know, what we need to look out for really is this: can my religion trump yours? And that is kind of at the base of a lot of this discussion. Can my religion, because I don't believe in immunizations, meaning that I'm not going to cover immunizations, or I don't believe in mental health, or whatever it is. Or as I said, to this extreme in this case, that I can't believe it isn't going to be overturned, but a federal judge actually said, okay to this guy, you don't have to testify. So it's something we need to be extremely mindful of, and I can't really predict the future, but I think, you know, we need to be watching that carefully and pushing back, both on, is religion going to dominate over research? And I totally agree with you. Globally, who are we as a country? What do we believe in? Or are we going to let this small group of religious people say, it's my religious freedom, forget that I'm taking away yours?
Hi, I'm Vicki Boyer. Thanks for being here today. On the economic issue, I always remind people that women still make only 77 cents on the dot for every dollar made by a man, and this puts a further burden on women. But since the purpose of having a corporation was to protect the owners or investors from certain liability issues, and the Supreme Court has now said to the owners, you are the corporation, have you seen any kind of lawsuits or interest in owners of a corporation who are the family getting sued for things, or are you looking out for that?
Well, fascinating question, because as we were writing our comments on what is a closely held corporation, we talked to a lot of law professors who are the experts in corporate law, something we haven't delved into too much before, and they brought up that very issue. So the concept is called piercing the corporate veil, meaning that you have this veil to protect your personal assets, and so the veil is the corporation. And you're right, that's why a family would have it. Right. So there's this other entity here, and I'm separate. If something happens with the corporation, that does not affect me and my other assets or whatever. And yet, if you are going to talk about identity of interest, and this is what the cases say, and that's what we're saying. We're saying, well, there has to be, if you're going to go this far, there has to be an identity of interest is the other term, meaning the corporation and the owners have the same interests, and therefore they're the only groups that can say no to some or all contraception. And does that then open them up to saying, well, if you're the same, then this veil will no longer exist for you? And we have been debating up and back on what we should be saying in our comments with these professors who say, well, you have to say that, because otherwise it can't be a lot of owners if they're all, you know, suppose 50, or certainly can't be publicly held with shareholders. How do you know everybody has that same religious belief? So some people have said, well, we don't want to use this theory because then we'll be saying, well, if you take this this exception for yourself, then you're opening yourselves up to other lawsuits. And I say, well, so what? If that's who they want to be, then that's who they are. So we'll see what ultimately comes out at the agency level. But you hit your finger on the button we've been struggling with. Good.
I'm fascinated. Oh, I'm sorry. Go ahead.
I have two questions, and I'll tell you, I don't know what I'm talking about. So one, I'm not a lawyer, but would there be any opportunity to argue that if these companies pay for Viagra, why aren't they paying for birth control? That's number one. Two, I'm Jewish, so I also have no idea what I'm talking about here, but the Pope seems to be a little bit more liberal, and has he come out and said anything about birth control, and would that affect Notre Dame and Georgetown's objection to it?
Right. Well, one thing I do want to say, Georgetown is using the accommodation. So they've said, okay, we're signing the piece of paper. So really it's only a small group of these nonprofits that don't want to sign
the university, not the hospital?
It's the whole thing. Yeah. The whole it's the whole Georgetown entity that is doing the accommodation. It does affect everybody. I mean, Georgetown is huge, obviously.
Well, we'll talk. I'm speaking on Thursday, so we'll talk.
Oh, okay, good. We have argued discrimination. So the Viagra versus, we have definitely said this is discriminatory. It hasn't gotten us that far, but we definitely have used that. And, I mean, I don't really know what, I don't think the Pope has said birth controls are okay. But even if he did, I mean, you know, some of these, and a lot of them aren't Catholic either. I mean, there's, you know, Mormons and Mennonites and all sorts of different religions. But I don't know, maybe if he did say that clearly, it might help in some cases. But the other thing to note is that, and again, just accepted by the court, was that some people think some birth control are really abortions. And the court's like, well, if you believe that, and we can't refute it. It's like, what about the scientists? Do we take that into account? Which is also, I should say, another scary thing. The Supreme Court's saying, well, we have no business really delving into your beliefs.
We'll go back to Darwinism.
Yeah, I mean, who knows where that's going to lead.
How about in the back there?
Yes, hi. Thank you for your talk. I'm Dick Chady, and I just wondered, you know, a lot of people see the Hobby Lobby and other cases as these poor little business owners just pursuing their religious freedom,
Right.
and there are these serious constitutional issues, but behind that, this has become a huge political issue. There's enormous interests, foundations, and think tanks that are financing the lawsuits and instigating them.
Oh, absolutely.
And I wonder, how much can you tell us about that? Because this is really, it's a wedge issue. It's an attempt by the Republicans to get the Catholic vote. So how much can you tell us about the big bucks behind the humble store owners?
Well, first of all, this humble store owner, you know, I don't know how many billions of dollars the company makes, but I believe they employ at least 10,000 people. And there are other huge companies that are, quote, called closely held, not publicly traded, that some of them, Cargill and Mars, I mean, they have hundreds of thousands of employees. So they're not all little. But I don't actually know where the money is, but there is a conservative legal group called the Beckett Fund. And they are the lawyers in a lot of these cases. So, and I mean, and Hobby Lobby actually covered contraceptives in their plans. And I believe what happened was the Beckett Fund went out and found them, and then they changed their policies, and then they became, you know, these heroes. They, by the way, have a lot of money and are building a personally financed museum behind the mall in DC on the history of the Bible.
Wow.
And
Who's doing that?
the owners, the Green family, the owners of Hobby Lobby.
Wow.
So there's a, you know, again, humble, they have a lot of money, and it should be an interesting museum, can I say?
Yes, I'm Patricia Yancey, and thank you for being here. I was curious, as a corporation, the pharmaceutical corporations, did they at any point weigh in on this issue? I know it would perceive to be self-serving because they would have benefited from more women using contraceptives, but I'm curious about that.
Not really.
Okay.
You're right. They haven't. I mean, they have. I mean, some of them have supported our work in implementing. So, for example, we have a hotline and website called Cover Her, and anybody. I probably should have said that from the outset. Any woman who is not getting her contraception without a copay, the one she needs, can go on this hotline and call us or write to us. And we have like all the regulations, all the guidance, model letters on what to tell your insurance company. I had to do an appeal for my own daughter. Poor thing, is a test case here. But at any rate, some companies are supporting us on that because they want this implemented. But in terms of getting involved in the litigation, not really. We did try to get a corporate brief saying, that would say to the court, well, you know, you open this up, then we're going to have to deal with our shareholders and whether we have a religion or we don't have a religion. Please stay away from this. And we got the Women's Chamber of Commerce did a brief, but that was it. So that tells you something too.
I'm fascinated with this issue of religion trumping the law and how far the court's willing to go. You know, we've recently had the marriage equality decision here in North Carolina, and we've had individual magistrates trying to set, or magistrates or recorders of deed saying, my religion forbids me from solemnizing a same-sex union. And that, you know, I think that's been dismissed as ridiculous, but I fully expect this argument to...
Absolutely. Well, we've seen cases where the florist, you know, won't participate in that ceremony, or the photographer won't participate, and yeah, this sort of religion versus individual rights is an issue not going.
But any sense of where the court is headed with this? How far Alito and Scalia and the boys are ready to take this?
Unfortunately, it's all boys. It's not all of the boys, but it is all the boys. Yeah, I mean, this brief that we are writing on the accommodation for nonprofits, we're writing to Justice Kennedy because he had a concurring opinion where he talked a lot about this accommodation can work, and it means that there would be, you know, the women would get the service like everybody else, and that's what you should go with. And so, you know, he's our guy. That's all I can say.
Yeah.
Actually, Vicki had a great point about like what's going on with pharmacist approval, refusal at this point.
That has kind of died down. So for a while, we had a lot of pharmacists just saying, I'm not going to fill your prescription. I mean, there were some outrageous incidents where I know one pharmacist, you know, was actually sued in Wisconsin, where he not only wouldn't fill the prescription, he took it from the woman and ripped it up. Yeah. So, I mean, it just, so she couldn't even take it somewhere else. The big chains,
which should be destroying property.
Right, at a minimum. The big chains all came out with policies that said, you know, you pharmacists, you don't have to fill a prescription you're uncomfortable with, but the woman can't leave the pharmacy without it. Right. So you got to give it to somebody else or find another way. And in extreme cases, people were like saying, well, that's like just handing the gun to a colleague, you know. But mostly that has died down. We once in a while hear a story like that, but not too much.
But it's not, they're not legally obligated, it's just the corporations. Some corporations have policies. There's nothing saying...
There's no federal law, but a number of states passed laws that said they had to, or they had to make sure she got it or something. And a woman in my office who is an expert on this, but we haven't had so many cases. Mostly we're hearing about now, you know, through this hotline, a variety of issues, and that's where I say it really needs to be implemented, because the insurance companies are not necessarily covering the whole range of contraceptives. My poor daughter's case, don't tell her if you meet her. I used her as an example. I always do. She needed a brand when there's a generic available, and the guidance clearly says, if the doctor says, you gotta have this, you should have this. So they gave it to her, but charged her $50. So we're appealing that as an experiment, see what happens. But we see a lot of that. We see a variety of problems. I mean, by and large, the number of women who are getting the contraception they want and need at no copay continues to rise dramatically. We're up to about 67% of the population, which is really phenomenal. Because there are still plans that are, quote, grandfathered, you know, that these rules don't apply to them yet. We're at about 75% of plans, employer plans in this country, are subject to these rules, but over time the other 25 will be. So we aren't even at 100% obligated under the law. We're you know, close to 70% of women are getting it. So we have made enormous strides. We just want to make sure it gets closer to 100%.
Maybe a couple more questions. David, and then in the back.
Just, if you would, I loved your idea or whatever you're doing with this calendar business.
Oh, yeah.
Could you share that with Rob? Because I'd love for us to distribute that. That's
okay,
great fodder.
Okay.
We'll definitely get that out online.
Okay. That'd be great.
And it's coverher.org?
Yes.
www.coverher.org.
One word. Yeah.
And in the back. Yes.
Every now and then I have a shiver of fear that there are going to be major successful attacks against the Affordable Care Act. Do you have any sense of, should I minimize the shiver of fear or not?
No. You got it. I would say this. I think it's here to stay. As I kind of said. I mean, 25 more insurance companies are participating this year. Rates are not going to go up that much, you know, at a minimum this year. The agencies promise it's going to be a smoother enrollment and re-enrollment. Obviously, we're holding our breath on that. But even politically, you just don't hear repeal so much. You hear, maybe you hear fix, repair. I mean, I got a lot of repairs, I would put it myself. A lot of things I would like to do to improve. I mean, don't forget, it was the Senate bill. It wasn't supposed to be the end of the story. It was one bill, and it passed the Senate barely, and Kennedy died, and Senator Brown came in, and it was clear that the bill could not pass the Senate again. So that's when Nancy Pelosi said to the House, you got to pass it as is. Because if we make any changes, it can't go back to the Senate and get passed again. So this is it. Do we want to take this imperfect thing? They had their own bill, which we really preferred for many reasons. And she said to, you know, her caucus, it's this or who knows how many years it's going to be. We got to take it. And they did, which is why I call it Pelosi care myself. And so it passed as is. So it's, you know, lots of things I would fix. But, you know, and people had said to me, you know, well, do you think we'll get these fixes? I mean, you know, Medicare gets tweaked like every Congress since it was started almost 50 years ago. And hopefully we're going to get to a place in our political life where we can do that and fix it. But I don't see it going away. There will still be attempts at sort of taking the heart out of it in some ways. But as long as we have Obama in the White House, that won't happen. And then I'll just leave that. We are a non-political C3 organization, so I'll just leave it at that.
For what it's worth, our own governor, who has, you know, spoken against expanding Medicaid for so long, is now his own Secretary of Health and Human Services. Is, you know, think of what you will of her. She has made these remarks that the governor is now seriously considering preparing to propose expansion of Medicaid cover here in North Carolina. So we'll see. You know, under some new regime, perhaps something different has been tried in some other states, but.
Yeah.
Messy, ugly, but still incremental progress.
Yeah, we have heard rumbles from about 10 more states, maybe 8 to 10 more states like that they want to do something, they want to move forward. I think over time we're going to see. It took Medicaid, it took 17 years to get Medicaid in every state. And so we're only at year 4 here. So.
Pretty good. Any final last words? One more question, Margaret.
Do you think we've got a broad arc here towards universal health care?
Well, I should, but obviously voting matters.
Well, join me in thanking our speaker one more time, Judy. Please be sure to check out our website. We'll have some of this information that Judy shared with us today. Also look for our anniversary celebration. It's on the front page of the Policy Watch website, the 10th anniversary. We'd love to, tickets will be on sale soon. We'd love for you to save the date for December 8th. Thank you, and we'll see you next time.